and welcome to Health Scope. My name is Teresa McCabe. I am a public health educator for the Environmental Health Division of Niagara County Department of Health. Today we're going to be talking about a very important and timely topic. We're going to be talking about the Community Health Improvement Plan. And my very special guest is my boss, Daniel Stapleton, who is the Director of Public Health for Niagara County. I'm very excited to have him here today, and we're going to learn a lot about our improvement plan. We're going to learn how you, as a citizen of Niagara County, can be a part of that your voice can be heard to help us to know what we should be doing to do better so that we can serve you in the best way possible. So, Dan, hello and welcome
Teresa,
to Health Scope.
Thank you for having me. I'm really happy to be here.
I'm so glad to have you. This is going to be a very interesting show, and I like the topic of today's show because, again, this is a show that will give the citizens of the county an opportunity to have input in what we do to serve them. So let's start out a little bit. Why don't we talk to the viewers a little about who you are and what you do for the county?
Well, I'm the Public Health Director for Niagara County, as you mentioned. I'm also considered the Chief Public Health Official for Niagara County. I've been with the County Health Department for 19 years, actually next week. So I've done everything from the financial operations, Deputy Public Health Director, and I've been the Public Health Director for now about 10 years. So it's a job I really enjoy. I've been in healthcare all my life, actually hands-on healthcare as well as public health, which really looks at the population that we serve. So it's a job I really enjoy. I have the opportunity to work with a great staff. The 100 employees from the health department really make it their life's work to serve the community. Not only the people who live in Niagara County, but the 7 to 8 million people who visit our county every year from 24 different countries.
Yes.
It's really a great, a large task and something that our staff has always been up to the task.
Yes. Well, I think it's really important to realize that when you're directing health, it's not just those residents, but we're responsible for a lot of people coming in, and all those people from other countries have concerns, and I think that just goes to show the breadth of knowledge that you have to have. So right now, we want to get right down to the nuts and bolts of what our program is about today, which is the Community Health Improvement Plan. And we're going to discuss this. This is something that the New York State Department of Health asks for the counties to do every couple of years. And so why don't you explain that to the viewers, let them know what the plan is, and we'll go on from there.
Sure. Well, the Community Health Improvement Plan has many different pieces of a puzzle, if you will. And what we start out with, the first thing we do is a community health assessment. And that just looks at the health status of the communities that we serve. It allows us to find out what's important to the communities that we serve. We look at data that also shows where the actual health status is of the communities that we serve, but also allows us to get information from the public on what's important to them and their family. For example, we ask people what keeps them from being as healthy as they can be. Do they have a primary care physician? Do they go to the doctor regularly? Do they have other issues that are important to them? It could be depression, which is a chronic disease now. It could be diabetes. It could be falls. It could be a number of different things. So we ask them what's important to them, and we do that through a survey. And right now we're doing the survey, and it's available through many different avenues, whether it's our Facebook page, whether it's our website, whether it's from flyers that we do. So we're doing that right now, and so far as of today, we've gotten 1,300 responses.
That's very good.
Our target is 2,000. We've only been the survey's only been available for a couple of weeks. We have until the end of April for people to complete that, but it really allows people to say what's really important to them. And once we do the survey, during the next month or so, we'll also be doing focus groups throughout Niagara County.
That's wonderful. You know, so oftentimes people pay taxes, they contribute to their government, and they often say, well, what's my government doing for me? This is something that your government is doing for you. We're asking what matters to you. And it's exciting that the public gets to talk to us. They get to tell us their health concerns, what matters to them, and it's just a wonderful way for all of us to come together, the citizens and the people who are working for the citizens. So I get excited about things like this because this is how change happens, and this is how the important things do stay the same.
Well, this is community health in its most basic and essential. Asking people what's important to them in terms of their health. It doesn't get any more basic than that and more grassroots than that. So it's something we take very seriously, and it's a great opportunity for the communities that we serve.
So let's talk a little bit about that process. So once people start filling out those surveys, what's the next step? What's happening?
Well, we look at whether it's online surveys or whether it's paper surveys that people fill out and get to us. We're working with our partners from the hospitals. We're doing it. We're making the survey available throughout the community, whether it's a tear-off strip that we all see up at the supermarket, or whether it's a bulletin that they see, or whether it's from the advertisements in the newspaper. We also use our Facebook page. We use press releases. We were just in 2 of our local papers just this weekend. So we do all that. We find out what's important to the people. We take that piece of the puzzle, if you will, and then we then do the focus groups. And then we look at the health status and the data we get from the CDC, New York State Department of Health, and so on. And we put all that together, and then we come up with priorities. For the last 3 years, our priorities have been chronic disease and falls prevention, primarily for seniors. So that's what we're working on now. But you know, what's important to the community may change. We want to make sure that we get the survey responses, but also the focus groups. Each hospital will be doing a focus group. The last time we did the focus groups, one of the hospitals did their medical staff. Another hospital did their volunteers. People have done their staff. People have done people who are visiting their clinics or their primary care practices. So we get not only the quantitative results from the survey, but we get the qualitative things from doing the focus groups. So we put all that information together into the Community Health Improvement Plan, come with our priorities, but we always want to make sure that just because we think we know what's important to the community, because we're part members of the community, doesn't mean we have everything and we have all of the answers. We really want to find out what's important to people. And last time we did this, chronic disease was very important to people in trying to not only prevent chronic disease but manage chronic disease. For example, one of our programs is it's for not only the person who has chronic disease but also their caregiver.
That's so important. That is so important. And again, defining chronic disease is something that's ongoing, never stopping, as opposed to something that's acute. If you have a cold or bronchitis, usually you get over that. But so a chronic disease is something that's ongoing, whether it's disease caused from a regular pathogen or an injury. It's something that's ongoing. And that is very hard on the caregivers, and so oftentimes we do forget those people. And it's very draining. It's very draining and can end up in sometimes, like you say, depression. That person can end up with their own chronic disease.
Yeah, I think a lot of people don't realize that depression is a chronic disease, you know, and it's a chronic disease that can help people from being able to manage their numbers. We talk about people managing their numbers, whether it's their weight, whether it's their sugar, whether it's their blood pressure, what the cholesterol level is. But if people need help getting through the day-to-day, then it's impossible for them to be able to focus on their numbers and making sure that they eat right, making sure that they get exercise, get enough sleep, things like that. So we deal with all of those things, and we know that there are other issues other than just the chronic disease and falls prevention, but we do know that those 2 areas were very important to the public, and that's really why we exist.
I agree. According to the surveys in the past, and with the knowledge that's being done right now, what do you feel that our county here is doing very right?
Well, when we got the results last time, and we put together our Community Health Improvement Plan, we identified areas where we can improve chronic disease care. So we have a chronic disease self-management program. That's a program I mentioned that is not only for the person with the chronic disease, but also their caregiver. We all know that if the person providing the care wears themselves down, gets to the point where they can't take care of their loved one, then the opportunity for people to stay in their home is greatly diminished. So we want to make sure we can help not only the person with the chronic disease, but also their caregiver. We also have a diabetes prevention program.
Yes, we do.
You know, we also have a diabetes management program. Well, we know right now that if we can prevent diabetes from ever occurring, if we can get people to attend our free programs when they're pre-diabetic, then we can stop that chronic disease from ever occurring. So we think that that's really an important approach to take, is to stop it before it happens. And knowing your numbers, we all know what we need to do to be healthier, but sometimes it helps someone who we consider an expert to kind of tell us some of the approaches we can take to make sure we stay healthier, and to know, when with these programs that I'm talking about, they're all free. There's 3 of them. They're run through the nursing division of the health department, and they take a commitment in time. But these types of diseases, these types of approaches, aren't something you learn what you need to learn in an hour or 2 hours. You need to really learn the techniques. We all know that people want to be able to age at home and take care of themselves at home and take care of their loved ones at home. And if we can do that, and we can help them do that, then we think that's really what we need to focus on. We used to be in the home care program. We used to have a home care program, and when that ended, we found out that we needed to look at, instead of going to someone's home and taking care of them with a chronic disease, let's try and prevent it. So that's really the approach we've taken. And as I mentioned earlier, the falls prevention for seniors is so also really important, because we know that one of the main reasons people are admitted to the hospital when they're elderly is because they've fallen. And removing the barriers, showing what they can do to make their home healthier, we think is really important.
Yes, that's what one of our programs is doing in Healthy Neighborhoods. We have our technicians in the home looking at possible problems, health problems, and one of the things that we're definitely doing is falls prevention in the homes. So yeah, it's a very, very big topic. Speaking of big topics, we've got a really big topic not only here that people in Niagara County might be concerned about, but worldwide, and that is the Zika virus. Let's touch base a little on that.
Well, we've been dealing with the Zika virus, getting information. I've had as many Sundays where I've had 3 different conference calls, whether it's with the CDC, with the New York State Department of Health, to talk about Zika. And there really are 2 mosquitoes that we're concerned about, the Aedes aegypti and the Aedes albopictus. And I'm not going to get technical with those, but we do know that those 2 mosquitoes have never been in the western region of New York State. And in fact, the Aedes aegypti, which is a more effective vector, is the one we're more concerned about, has never been in New York State. The albopictus has been downstate, but it's not as effective of a vector or of a transmitter of the Zika virus. So we need to make sure we're prepared. We do trapping of mosquitoes, we do the testing of mosquitoes, and we never have had a mosquito with this. But I'm not a mosquito expert, but there's at least 5 to 10 different mosquitoes that we have just in Niagara County and just in New York State. So, and if you look at all of the mosquitoes, there are dozens. So we're making sure that working with the New York State Department of Health, we're continuing to trap the mosquitoes. We're doing it earlier this year than we normally do because of being a fairly mild winter until this week. So we'll be trapping the mosquitoes a little earlier this year. We'll be monitoring to see where are those mosquitoes that we're talking about, that we're concerned about. Right now, the Aedes aegypti, which is not only a day feeder but a night feeder, we're worried about that because we always typically think, well, we don't have to worry about mosquitoes during the day. But if this mosquito that is not here and has never been in our county, if it gets to New York State, we need to be prepared. We don't wait for a disease to be a threat to our public. We are planning before that. So we're very involved with it. The number of concern is still for pregnant women. If pregnant women are visiting areas that are known to have the Zika virus being transmitted, then they should avoid that area. And the information changes daily. But we do know that prevention is the number one way to protect people. Right now, the risk for members of the public in Niagara County is very, very low. But we will be ready if we get any concerns. But it's already they're already watching, the entomologists are watching the travel of mosquitoes. And right now, those mosquitoes that we're more concerned about, the CDC is more concerned about, are really Central and South America, the southern part of New York State, or of the United States, Texas, New Mexico, Florida, Louisiana, and so on. And our concern is we're going to watch it to see how the migration happens. We do know that we know a lot about mosquitoes. I know more about mosquitoes than I ever thought I would know. But the things we do know is, we want to make sure we prevent the mosquitoes from larvae from ever hatching. People don't know this, but a mosquito can lay larvae, and that can lay dormant for 10 years. And you have one wet summer, and those larvae can pop. So we not only want to prevent the larvae from ever populating, but we also make sure we control the adult population of mosquitoes. But right now, minimal risk. The fact is that the mosquitoes have not moved up any higher, but we're keeping an eye on it to make sure people are protected.
Yes. So many people don't realize that, they know that mosquitoes like water, but any type of standing water. If you have a bird bath that you're not changing the water in, you're just not paying attention to, it's on your property, that has standing water. Old tires collect water, tire swings collect water, even a saucer of water on your porch. If you're not dumping it, mosquitoes can lay eggs in it. So it's really important to remove all standing water for mosquitoes.
Well, I've heard from the CDC that just a cap from the top of your water bottle, turn it upside down, is enough for the larvae to lay their eggs and to get mosquitoes. So, you're right, absolutely. We want to make sure that standing water is removed, and it makes sure that you and your family remain safe. But we're on top of this. This is one of the things when I talk about our life's work. The people work in public health, their life's work is to protect the public. So we're on top of this. We're learning about it every day, and we'll make sure that the people of Niagara County are safe.
The Zika virus is a virus. You're going to have certain types of malaise from it, but we also know that it can be sexually transmitted. And this is where our concern is that a woman can get the virus from a partner, and if she's pregnant. So it's really important if people are going to travel to those southern areas or where the virus is happening, that they either contact our health department, contact the CDC sites, and to know where the virus is, to use plenty of insecticides, mosquito repellents with DEET. It's really important because if you are traveling, no one wants to get sick. So protect yourself. It's really important. There's a lot of good things going on with health all over the county, and one of the things that I get really excited about are all of the things where volunteers all come together to promote community health, whether it be for chronic disease management, such as the breast cancer relays, the Alzheimer's walk. You want to comment a little bit about that volunteer spirit and some of the things that are being done in our county?
Well, you hit the nail on the head. It's important that people get involved as much as possible in these types of events. There's never a shortage of these types of events, whether it's in the summertime when most of them are, or whether it's during the winter. Those things are still going on. We like to say that we want people to take some personal responsibility for what they can do to make themselves healthier. There will be diseases that people need to respond to and protect themselves from, and that's part of our job in the health department, is to protect people from these diseases, whether it's Zika, whether it's SARS, whether it's Ebola, whether it's EVD68. The diseases never stop. So when the public can learn about these diseases from the relays and things like that, that's really important. We want to give people the tools so that they can do what they need to do to make sure that they and their families are safe.
That's great. One of the things that's really close to our heart too is the rabies vaccines. Rabies is one of the deadliest diseases on the planet, and our county health department realizes that. So many people are not aware of just how important that is. You want to talk a little bit about the law, about why pet owners have to do what they do and what our program is?
Well, people need to make sure that they're vaccinating their pets. That's the number one thing. Unfortunately, just a few weeks ago, we had to have a pet that was destroyed because they didn't have their rabies vaccination. And this family had another pet. That pet was vaccinated and just needed to get a booster shot. So it's the law that the pets are vaccinated, but it's also, we want to make sure people don't have to put down their pet, their member of their family, because they didn't take the time to go to a free rabies site. We have these clinics throughout the year, multiple ones, so that people need to take take an active role in that. I talk about the health department, and I talk about, I have a saying whenever I go to speak to the public, and it's that's if you drink the water, you breathe the air, or you eat in a restaurant in Niagara County, then the public health department, the Niagara County Department of Health, has a positive impact on your life and the care of those you love. This week is National Public Health Week, and it's been recognized by President Obama and the CDC and so on. But it's my opportunity to express my appreciation to the staff that we have in Niagara County. I talk about life's work, the life's work of people who have spent their whole entire career making sure that people are safe. Whether it's our nurses, public nurses, whether it's our engineers, our sanitarians, our public health technicians, whether it's our special education teachers,
Absolutely.
our speech pathologists, our occupational therapists, whether it's the people who provide the clerical support to the health department. Those are the people that are really important. We want to make sure that we recognize and thank them for their life's work.
I agree, and there are so many wonderful people that I work with at the health department. I'm so grateful for what I do, the opportunity to do that, and to work with such wonderful people. We hope that you really got some great information today. Don't forget about our website, www.niagaracounty.com, and click the Public Health tab and learn more about what we've been talking about today. My name is Teresa McCabe. I want to thank Daniel Stapleton,
Thank you, Teresa.
Director of Public Health for Niagara County. Please remember to be healthy, get out there, get involved, and especially get to know our survey and all the things that you can do to stay healthy and happy. Thanks a lot, and have a great week. Now, don't talk loud. Just